So things has been getting pretty intense since 2 days ago for us. The latest brain MRI scan result came back, and my mom's tumors in her brain have been all increasing in size, with one that has almost tripled in size since her last scan a month ago. And at this point, there's not much we can do, and I've been told by the doctor that that tumor could hemorrhage at any time, and that we need to be prepared for that to happen. My dad has been pouring his life into saving my mom for the last 3 years. So he is not someone that gives up easily, and so he went to see an expert that he's been seeing, like another doctor, at a better hospital. And the doctor gave advice to introduce another chemotherapy drug for my mom. And he was talking to me about that, and I basically told him that I think we should ask my mom if she wants to receive chemotherapy at this point, because I know from talking to her that she doesn't want to. She doesn't want things to get worse. Like, she doesn't want to experience more discomfort from like another therapy or drug or whatever. She's very reluctant to even take like heavy dose painkillers like morphine. She's been staying off of that this whole time. She doesn't want to take it. So I told my dad, because in the last 3 years, I'm not sure how it is in the US. I'm pretty sure if you're an adult, you are asked, the patient's opinion is very important. But here it seems like the family makes all of the decisions for the patient. Sometimes they don't even tell the patients what's going on, or they don't have any. It's like the patients don't have any say here, which I thought is really strange, especially at this point, at this stage. During the last days of my mom's life, where in the last 3 years she pretty much didn't have any say in any of the therapies that she had received. She was just basically being told, this is what you're going to do each time. And there were times when she really didn't want to get, like, for example, the one chemo session she received, she really didn't want to do that, but she went with it anyways. So I just thought that it's important for her to have a say in this now, before it's too late, before she loses her last chance to choose for herself. And it's not because of any kind of injustice or anything. It's just the way things are here, kind of. Like, death is not discussed openly. A lot of things are very hush-hush. Like, uncomfortable feelings are not being shared openly. Like, my parents don't really have open communication with each other about their deepest feelings about things and their emotions. So this is what we're dealing with, and this is what it is, and it's fine. That's a lot of it is very cultural. which I totally understand. But I just think that, watching my mom suffer, I want to respect her will on how she chooses to live the rest of her days. Even though she doesn't have very long left, and I think it would be almost selfish for us to make decisions for her, thinking this is best for her versus that, and because in the end she is the one that is receiving, she's the one that's on the receiving end, and she's the one that has to deal with all of the consequences, like the physical pains and the throwing up and the vomiting and the dizziness and all of the things that comes with additional treatment. She is the one that has to suffer through them. We just, it's not fair for us to just be making these decisions for her. And I explained that to my dad, and I think he really understands that. And he's very respectful of that. However, he doesn't know how to let go of this role of the protector, the person that's saving my mom, that has been trying so hard and putting all of his time and energy and all of his heart into this is like his life's work for the last 3 years. And I understand it's very difficult for him to just say, okay, I'm gonna throw in the towel and and watch things take its natural course. However, I think so that's why he told me, then you go have this conversation with your mom, because I can't be the one that says we're not gonna do more treatment, we're just gonna give up. And I think that's really interesting, because to me, I don't think it's giving up, but I do understand why he feels like it's giving up. I mean, this is how we've been taught that we need to do things to validate, like, that we're trying, that we're helping. But I think sometimes we need to see that there's a time for doing, and there's also a time for doing nothing. And doing nothing is not something we have much practice in, because we've been just doing and doing and doing, and we only see value in doing. We don't see value in non-doing. But this is the time I feel like that we need to practice the non-doing, because I do think that at some point, I think that becomes the doing nothing is the biggest act of compassion. I know it's so it's in so much contrast with everything that we have been taught or programmed to think up till this point. But we think that we have to save people, we have to help them, and we have to be doing something. But I think in this situation, I think the best thing is to just do nothing, in the sense that stop trying to try to change the situation to how we want it, and maybe respect the person who is actually being affected by all these choices and our doings, and respect that person and let that person choose for herself. So, yeah. Yeah. Bye.